Can you hear me? Okay, that's good. Okay, so as I was preparing for this and trying to get something together to talk about and kind of watch this stuff this morning and to follow Dr. Starcher, that's pretty tough. She did pretty good looking at the screen down there. But I really wanted to try to give you a snapshot of what I believe and what AccessHealth, where we're at in the community, and what we believe are pressing things. So what I want to do is I want to tell you a little bit about us and explain, if you don't know who we are, to try to let you understand a little bit who we are, and then tell you a little bit about what we're doing, and then I want to finish with some challenges of the community that I believe in the healthcare community. So first, starting out, I really believe that there's certain foundational cornerstones to the community that to be vibrant and successful. These cornerstones, some of them would be, to really have the success, to have a strong community. I believe that you must have a strong faith-based and cultural heritage. I believe that we need a strong educational system, as Dr. Starcher just talked about. We need a strong economic development system. And we need organized policy and leadership, and that's a part of what this has been put together to do. And so in order to move forward, as our future forward says, I believe that all of these things, and some others, need to be prevalent to be a successful community. AccessHealth is a mission-driven organization. We are a federally qualified health center. We're a nonprofit. When you look at health centers across the state, 1 out of 3 patients in West Virginia are seen by health centers. And so not just with AccessHealth, but with other health centers around the state, we're a big part of the healthcare delivery system. And with that, a lot of your indigent, 70-some% of the patients that's seen by health centers across the state are low income. And so it's very important for these organizations around the state and for AccessHealth, really when our leadership, our management team, and our board of directors, we really live healthcare. And I think that the mission focus that we have separates us different from other organizations, but it's very relevant to this discussion of how do we move forward in this community. Currently, AccessHealth has we have 330 employees made up of 54 physicians, 26 advanced practice clinicians, 10 pharmacists, and 9 licensed counselors. And then the rest of them are made up with administrative and support staff. Our focus primarily is family medicine, pediatrics, obstetrics and gynecology, adult medicine, behavioral health, lab, pharmacy, and imaging. And one thing that makes us unique of the practitioners of all these that I listed, most of these went to elementary school, middle school, and high school within the area. I think that is what makes us unique and sets us apart as from other health centers and other healthcare providers. So I'm really proud of the fact that we are our own. We do believe in what we do, and we live here, and we continue to be a part of this community. We currently operate at about a $60 million budget. We see over 50,000 patients in our service area a year. We have 15 locations in Raleigh County, Fayette County, and a location in Greenbrier County. Currently, AccessHealth partners with the Raleigh County School Board to offer 12 school-based sites. And that's really flourished over the last year or two, and we look forward to where that's going. Across the state, health centers keep up with about 48,000 students. And so school-based health is very important to what we do, not only at AccessHealth, but within health centers. These are full-service locations that it's just like going to your physician's office that you can go to, that your kids can go to be taken care of by advanced practice practitioners. And it's really a good relationship that we've developed with the Raleigh County School Board. And within our last location with the new Stratton School, that's our first site that actually the community and the students can be seen at that location. In 2011, one of our most proud things that we have, and one of the things that I believe we've positively affected the medical community, is that we become one of 11 teaching health centers nationally. Teaching health center, what we do with that is we train residents which have already graduated medical school. In our program is we have 12 residents, family practice, and they graduate 4 a year. Within that, with the shortage of physicians in communities, we've seen that within our community the last several years. AccessHealth has been responsible for placement of over 40 family practice physicians. Over 60% of those are within our community currently that have graduated. So if you take away 60%, if you take away 24 docs from this community today, you can see where we would be in trouble without family practice medicine. 14 of those graduates are currently continuing employment at AccessHealth. That's kind of a snapshot of who we are, what our plans are, what we're looking at forward, and I think this is very relevant for the future to move forward, is just a couple goals that we have for the next couple years is to continue to provide quality health care, promoting health equity by removing barriers to care based on factors such as socioeconomics. We believe that your income shouldn't limit you to be able to get good quality care. We believe that's something that everyone should have available to them. We believe that we should have the available resources and create additional financial resources to make sure that everyone has access that they need. Transportation is another big issue that I believe at AccessHealth that we need to do a better job with and within the community. So one of the things that we do with that, and the school-based clinics are a perfect example of this, is that we go to the patients. We go to where the patients are. Our locations that we have are strategically located on all of the smaller communities around that come into an inlet of Beckley. We believe that we need to do our part in helping out with public transportation. We believe that we need to address health disparities. We're all Southern West Virginians. We recognize that we have some of the nation's highest levels of heart disease, diabetes, cancers, and one that's come up over the last several years, it seems like addictions and substance abuse. Those are key areas that, as we plan for our next couple of years, that we'll be looking at to help combat these diseases and these conditions. Availability and accessibility of quality health care. It's a big part. As I said in the beginning, if you don't have good quality health care in a community, you can't be successful. So we'll be focusing on the continued growth of AccessHealth. We'll be implementing more school-based programs, some of those to begin in the fall. Facility investment, we've invested the last couple of years over facilities. We have a new OB-GYN facility getting ready to open up. We have a new clinic at our Fayette location that's getting ready to open up. And we continue to want to have the state-of-the-art, safe, accessible, attractive locations to serve people. We believe that collaboration and integration is a big part of accessibility and availability. We believe that we should improve our specialty networks. There's no reason why that there's lots of specialties that you should be able to go see a doctor here in this community. It'll be a big focus for us for the next couple of years. We believe that specialty networks have to be developed, and we have to keep the doctors in our community. We need to identify health needs and implement services to address these unmet needs. There's several areas that we've identified over the last couple of years and one of those areas, what we've already talked about, is the substance abuse, those types of things, that there's unmet needs there. We're looking forward to trying to do our part to help with that. and identify and coordinate with a lot of our nonprofit helps organizations. There's lots of organizations, if we could just get them connected in this community and pull them together. So we really were focusing on building stronger hospital relationships, improving that continuity of care, and help stabilize the delivery model. We understand that the healthcare community has been under a lot of stress over the last couple years, and we want to do our part. Number two, as far as our goals, would be continue to facilitate and develop community wellness programs, promote employee health. We have a huge employee health program. We have our own gym that, and we're always doing some kind of challenge to try to encourage health of our employees. Within that, we want to offer that to local businesses and try to put a clinical perspective on wellness and fitness. The other area, which is a challenge in our community, would be provide opportunities for healthier choices. When it comes to diet and exercise, collaboratives for farmers markets, doing things like where we can buy healthier foods, or at least stuff that is grown in our area. We believe that that's an area that could be very, very much improved. Collaboratives with local gyms and fitness facilities to try to make sure that we can help our patients, help our community, get the resources that they need to live healthier lifestyles. Thirdly and finally is continue to facilitate educational programs and train tomorrow's healthcare workforce. It's while supporting the current workforce. After COVID, and during COVID, workforce development was really tough. And those are areas that we believe that continue to need work. And so a part of what we'll do is, what we're looking to do is continue the residency program, coordinate with local schools, educational programs and universities to help reduce healthcare workforce shortages. We still have a shortage of nurses in this community. And in order to get to that level of providing the health care that's needed, we need to do a better job there. As far as the current workforce, is to ensure wages, benefits, and work environment are conducive to a strong organization. We have to be able to compete with those around us, the larger hospitals, the larger communities. We have to do those. Something I heard this morning that's on our agenda would be to address child care. We have to, it seems to be one of the biggest employment issues that we have is the challenges with child care, and I think that you would say the same thing. So what are the risks to the community? What are the things when we look at health care, what's the challenges that we're facing right now, and what's the things that's going to get in our way of being successful as a community? Not in any particular order, but the first would be too much regulatory bureaucracy and government overreach. We have to be careful about, we're excited about, we're always excited about quality initiatives. We're always excited about trying to make sure that we deliver better quality, but we still believe that patient care is done when the exam room door closes with the physician and the patient, and it needs to be maintained within that. So overreach of government just has been the bureaucracy over the last several years, and been able for a private practice doctor to even run an office is nearly impossible. Loss of resources in the community. That's something that's challenging us, and I think that we're kind of caught in the middle of a healthcare war within our community. Larger healthcare organizations outside of our area have continued to look to improve their market share to compete with one another while weakening our community resources. Therefore limiting the basic healthcare services here at home. We encourage outsiders, we encourage and appreciate community development, but not at the expense and lack of accessibility and availability of our services locally. Local specialists leaving the community. These, again, it's so hard to maintain with what's going on with our larger tertiary centers and things outside of our area, pulling away our specialists. Those are becoming very challenging to our area and to our population to be able to get these services without traveling a long distance. Lack of community support and teamwork. This was talked a little bit about this morning, workforce development. That's the area that we have to come together and support and build some teamwork to make sure that we can work on workforce development. And again, child care would be a big part of our workforce development. This event actually is an encouragement. I think it's going to take a couple years maybe to get it to where we would like to see it, but I thank the Chamber for giving us this opportunity to really start to talk about these issues, to have our elected officials to be able to come in, hear some of these issues, and discuss some of these issues. I think are very critical to move forward to a successful community. As a lifetime member of this community, I would be the first to say that we aren't the best at teamwork. We struggle with that, and I don't know what it is that causes that, but we struggle with teamwork. We struggle with encouraging each other in our business ventures, in the things that we need to do to become a better community, and we lack the support sometimes of one another. So as I finish up, I would like to invite all the elected officials, the business community, the government agencies, the academic institutions, the churches, and the nonprofits to partner in developing a plan to address and overcome the challenges we face and to support the local system to move forward and make sure that our younger people will have a future. So that's kind of my perspective from AccessHealth. I'll be around. If you have any questions, let me know, and I'll be more than willing to have some conversations with you. And again, I thank the Chamber for the opportunity to speak, and look forward to hearing from the candidates later. Thank you.